LED Medical Diagnostics is a global technology leader in the development of tissue fluorescence visualization. LED is already an industry leader, but now they have plans to grow even larger. Dr. David Gain is president and CEO of LED Medical Diagnostics. He's also a dentist and has seen firsthand the devastating effects of oral cancer.
It's a very significant problem. A person dies every hour from oral cancer. And the important thing, of course, like all cancers, is early detection is critical.
LED's VELscope VX enhanced oral assessment system has become the dental industry's leading screening device for oral tissue abnormalities.
The VELscope allows for the dentist to be able to diagnose these mucosal lesions quite early. It has an onboard camera that allows the imaging, also the communication of these images to other members of the treatment team, which is very, very important.
It's really the only system out there that allows you really simple point and shoot capability. You just snap it on, basically point and shoot, and you can take fluorescence photographs.
The VELscope VX was developed in partnership with the British Columbia Cancer Agency and backed by more than $50 million in funding by the National Institutes of Health and other U.S. and Canadian government and private organizations.
We've been refining and optimizing the VELscope for the last 10 years. We dominate this space in that we are the very first to come to market with fluorescence visualization in dentistry and currently the market leader. What I see is we'll continue to dominate the space in fluorescence visualization in dentistry.
So far, more than 12,000 dentists in 23 countries have performed more than 25 million exams using LED's cancer detection devices.
My name is Dr. Ken Newman, and I've had absolutely a wonderful career. I have had the pleasure of using VELscope in my practice for the last 8 years, so actually ever since it came out. For us in practice, over the period of time when we started using the VELscope, my goal was if I could save one person's life in all the time that I used this, it would have been worthwhile, all the learning and everything else that goes into it, and we were lucky enough to be able to save 3 people's lives. Hopefully most of the people that do have dentists are going to be having these oral cancer screenings done on a regular basis, at least an annual basis. And also the hope is that more and more of the general dentists will be using the VELscope as a tool to help them add to what they can see and feel in the mouth. The response to this program has been absolutely amazing. A week before the program started, every single one of the programs that they had were sold out and had waiting lists. And as a result, added an extra 5 programs. And they sold out within probably a day.
Many of the early changes cannot be easily or readily visualized, especially when surgeons decide the surgical margin in the operating room. We have a new device developed from BC, and we have been using that to observe the oral lesion extension of premalignancy and the cancer. It's a blue light. It's not fluorescence light, not UV light. It's just a white light using a filter. Only the blue light can pass through, and so it's no harm to the body. And so when we shine the light to the tissue will automatically generate a color called tissue autofluorescence. It's shining as a green color. So when we shine this blue light to tissue, if it's normal, we'll have a green tissue autofluorescence. So we can observe this green light. And if it's abnormal, it will lose of this green light, so it will show dark. So dark and the green, so easy to distinguish. Then mucosa usually red, redder, pink. It's hard to distinguish to many of the clinicians' eye. With this device, and we can see those clinically not apparent change that we can decide a better margin. It's not to cut a wider area, but it's better area. For those area need to be cut, then we remove, but not, so we don't do overcut or undercut. Head and neck surgeons are willing to adopt this technique in changing their practice, because currently they just use their naked eye to decide the surgical margin, and this is really revolutionized the way how they visualize the lesion and do a better surgical treatment. Green tissue autofluorescence that indicate the normal tissue. If there's abnormal change, for example, cancerous tissue or precancerous change, that we might see loss of this green tissue autofluorescence, and then we can clearly see the extension of those diseased tissue.
What we've done here is we've used autofluorescence, which is the excitation of the tissues with a monofilter light to help demarcate the surgical margins. Conventionally, what we would do is use white light magnification. What autofluorescence allows us to do is add a new dimension to detect abnormalities which may be histologic or perhaps only genetic, and use those in a real-time way to evaluate surgical margins.
What is it that makes you guys winners year after year after year?
Very honored, very honored. Well, I think a lot of it is dedication to the cause. We really believe that what we're doing has an impact in terms of saving lives, and it's that commitment to helping our dentists and helping the dental communities provide a service for their patients that finds a way, hopefully, to improve, and from that, hopefully, has a way to impact industry in general.
Well, LED has been doing a lot of really important work, so congratulations on this, and keep up all the good work that you guys do.
Thank you very much.
Thanks for joining us.